Welcome to the podcast, sir. I have heard from Sunil sir that you have 6 branches in this city.
Yeah,
For
thank you,
a
Prathmesh. Yes.
for a dentist from now, or maybe if I want to open a clinic, it is very hard for me, or maybe it is very crucial for me to think कि एक ब्रांच खोलना है. उसको खोलने के लिए बहुत सारा एफर्ट्स लगेगा. I don't know if it will run or not. In this situation, you have 6 branches. I want to ask you, for a dentist like me who wants to open a clinic, or maybe the dentist who have opened one clinic now, even though it is not for the 6 branches, how does he run that single chair successfully?
Basically, everything starts with a small initial or a small capital. So even I had a single clinic for about 3-4 years. My second branch was after 4 years, but my third, fourth, fifth, sixth branches came after 12 or 13 years of practice. So I suggest all those upcoming dentists. So first initial 5 to 10 years of your career, focus on one branch. Make it very as much big as possible. Even if you're started as 2 chairs, you should make it into 3 or 4. Maybe after 5 to 10 years, based upon your comfort levels, for your economic and financial levels, then you can scale up to the multiple practices. I really don't suggest anyone starter to have multiple branches, even if you have adequate resources to start one also. So that it should be an experiential learning to know how to run one, and then you learn 2, and then you learn make it to 3 like that.
Okay. How much satisfied are you with the general dentistry?
Very much satisfied. 100% satisfied. I am a kind of person who believes that until and unless you love what you do, you don't. If you have passion in what you do, you can excel in any work.
Yes. If I have to give you any option, like for example, if you go back to your age where you are like 17 or 16, and now you have to make a decision to choose a career, would you really choose dentistry again?
That's a very good question, because I have faced it quite a lot of times in the recent times, because I have joined my elder daughter into dentistry. So I have seen most of my friends asking me, तूने फिर डेंटिस्ट्री में क्यों ला लिया? तुम देख नहीं रहे कितना कंपटीशन बढ़ रहा है? But I feel no, even naturally for all of us, like people like our age and all, dentistry is a second choice, because we couldn't get into medical seat, so we chose dental seat. But now I'm quite far comfortably placed to my medical friends. At least I'm not talking in terms of revenues or kind of incomes that are involved in any medical hospital and all. But I am kind of very laid back kind of lifestyle I have. I can travel in much. I don't have any emergencies, and I don't need huge capitals like maybe 15-20 crores and all to open a hospital and all.
Right.
So in that sense, and also I don't have any night duties and emergencies. I don't deal with death, kind of thing day in and day out. And I'm in the business of creating healthy smiles, making more better happiness, bringing happiness into the future patients' lives and all. That's what I love, and I recommend everybody to take dentistry, actually speaking.
What is the idea of you of expanding 6 chains in one city?
As of now, I'm in one city only. We don't know. I might even grow to other cities also. But right now, I'm in the kind of comforting factor. Some more are in pipeline in the Hyderabad only. But I don't know. Eventually, I might go into other cities also. But right now, I'm in Hyderabad, happy, comfortable with the 6 branches. Maybe in another couple of years, 2 or more in pipeline.
Okay. Are you trying to reach more of the areas here?
Yeah, it is something like, Hyderabad is a rapidly growing metro, one of the most rapidly growing cities in the world also. So what happens is patients coming from one corner to other corner are drastically coming down. In earlier practices, I have seen, 20 years back when I started practice, I used to have that loyal patients who used to travel from other end of the city, and even other parts of the state also. But now, traveling has become such a difficult thing. So people call me and say, that branch is very far, we cannot come. So can you suggest someone near my place where I stay and all?
Right.
So naturally, branching is one of the essential part of the thing. When you want a product or your thing to grow into the market, you need to have in multiple locations.
Okay. You are an orthodontist also.
Yes.
A very successful orthodontist, I must say. Why did you choose orthodontics as a specialization?
Back then in 2002, when I chose orthodontics, orthodontics and surgery used to be the most sought after branches. And orthodontics was said to be like in a branch wherein you can make more money with less of effort. And for becoming a successful maxillofacial surgeon, you need to be associated with an hospital, and again you might be having night duties and kind of stuff. So ortho, you can make faster money. That's what is the perception at that time. But otherwise, my favorite subjects were only orthodontics and maxillofacial surgery. If not for those two, I wouldn't have done MDS at all. With due respect to all other branches of dentistry, my personal choice. Why? Because it's only the kind of work what we do in orthodontics. Hardly anything is taught in undergraduate curriculum. And that's true, I think, even in the present day curriculum also. A lot of orthodontics is like unknown to the general dentist, number one. And number two, surgery is one thing where you feel at least closer to the medical fraternity.
Right.
Where, you see blood, you see, you do surgeries, you put stitches and all. So you feel close to being a medical doctor.
Okay.
And I still have a great respect, and given a chance, in my wildest dreams, if I want to do one more MDS again, I would do in maxillofacial surgery.
Oh, okay. How much can the orthodontist make right now?
It depends upon the kind of area he practices, whether he's going for consultations or having his own practice, whether he's willing to go for outside consultations also, because back then I used to be like traveling a lot to nearby taluka places and district places. I used to go to some other states also, like AP, Maharashtra also. But what would I say is still orthodontist can make the fastest money if he is willing to travel and consult clinics, because still now 95% of the dentists will have to be depending upon orthodontist for getting their services.
Ji.
So compared to other branches, I feel orthodontist can make money. Depends upon again what kind of practice. If he is doing only exclusively brackets and aligners also he is doing or not, whether he is actively giving all the kind of wide range of services that comes under orthodontics.
Okay. What do you think about the future of this field?
Definitely very promising. Which future is there, because there are a lot many advanced new techniques which are need to be updated, and the kind of dentistry what we used to do 15-20 years back is no more the same. So once you take up the challenge of learning everything new, keep yourself updated, keep your team updated about the dentistry, then you will definitely prosper like anything in dentistry.
Okay. Sir, do you think aligners and the tech that is coming in orthodontics will kill its growth for the orthodontics?
No. What happens is anything that's new, anything that's seems to be appearing very easy will be very catchy. But in the long run, whatever that stands the time of perseverance only will stay. For example, I think most of the management books or business books, they tell how Nokia was like leading into the mobile market during about 2 decades back. And once the smartphones came, that Nokia has not updated itself, and so it has perished. So similarly, maybe 20 years now, 10 years from now, people might say 30 years back they used to do braces and wires, and now it's only aligner market.
Right.
So everybody has to go through the transition phase. Now we are going not only in dentistry, even in our life also, in our day-to-day things what we use, there will be a transition phase, and we should not be afraid of this transition. Yes, if the aligners will eat up the bracket market, so be it so. So you should be able to grasp the aligner market. But if you keep saying that aligners are not for me, braces are the best, then probably you will also be perished.
What I like about orthodontics is if you have a patient, you have put them a braces. Now they are continuously 24/7 they are making marketing. When they are talking to some people, if they are smiling to someone, everyone can see that they have put the braces. They'll ask, where did you put? It is very interesting about that. But many of the people think that orthodontics is just braces. How would you tell them that it is very expandable branch? It is very vast branch. Would you like to enlighten on those procedures?
Yes, that's what the picture comes of, kind of these kind of interviews, very good initiative by you people and by the Instagram and all that stuff. Previously, it's only when the patient walks into your doorstep, you have an opportunity to tell about the various kind of services you provide. But now, with the advent of social media, there are a lot many things. You can change the jaws. You can even grow the jaws with mandibular advancement appliances. You can even change the smiles with gummy smiles by dentofacial orthopedics. And even if you don't want to show your braces, we have something called as aligners now.
Right.
Even if you very severe cases also have been treated by aligners now. And apart from that, people with suffering with cleft lip and palate and kind of congenital deformities, even these kind of cases can be treated very well with orthodontics in conjunction with other branches of dentistry like maxillofacial surgery, and also other part of medical specialties also like ENT specialists and plastic surgeons. So orthodontics, if you think it's only about braces and wires, no, it is not no more like that, and it is got much more scope beyond braces and wires.
Right.
And if you can understand this concept, there's much more to do in orthodontics.
You make a lot of videos like this to educate people.
Yes.
How much important is it for dentists to grow on social media?
Very much important. Until 2 years back, I never had even an Instagram account. My daughter created one for me, which was like almost redundant. But the moment I understood, my team made me understand that, okay, we need to do on this, and I'm actively working on this. And I take it as like very challenging with my team, with my marketing team, with my doctors team, who are all continuously encouraging me to do it. It's not that how good work you do, it's that how many people are able to know that how good is your work.
Right.
You can treat only 10 patients in a day or maximum 200 to 300 in a month. But then if you can train and you can educate 1,000 people or 10,000 people through your work that you or your team are doing so and so good work, then naturally you can encourage a lot of other people to do it. And surprising thing is nowadays when I go to any conferences, when any meetings and all, I see younger dentists coming up and saying, sir, you are doing very good work, sir. I have shown my video, this particular video to my patient, and he got convinced for that procedure, sir. So when you think about the bigger good that's happening when you're trying to promote the knowledge, the results are, the repercussions are like tremendous. So every dentist should promote their work on social media, irrespective of whether they are practicing in a smaller scale, bigger scale, smaller city or bigger city.
There is this fight between if I should put braces or if I should put aligners. Leave patient, someone from your family wants to align their teeth. What would you suggest them to go for, braces or aligners, and why?
Yeah. People ask me nowadays that I have been doing Invisalign a lot, and I'm a diamond provider of Invisalign in Hyderabad, so one of the top provider of Invisalign in India. So I may become like a salesperson of aligners. No, not like that. Depends upon the different time frame of your thought process. 8 years back, my elder daughter I treated with braces.
Okay.
Because at that time Invisalign was not so active in India, and I didn't have so much confidence on that appliance. But now my younger daughter, I am treating with Invisalign. So if I go back and thinking that all those patients whom I have had treated with braces or lingual appliances, did I do any injustice to them by not prescribing aligners to them? Or if I shun away those patients now saying that Invisalign is expensive, so I'll do braces only? No. It depends upon multiple factors, like what the patient wants. Some patients, if not for aligners, they will not even go for treatment because they don't want to show the braces.
Right.
Some patients, even though how simpler the case might be, they don't want to show their braces. So for them, aligners is the best choice. For some patients, they can't afford. Aligners are still expensive.
Right.
However widely available they are, still they are expensive than braces. So you can't put all the patients, just because you are doing aligners, you are getting better results, you cannot give aligners to all the patients. So basically, whatever the controversy or whatever the argument might be, which is best, basically you have to see the patient first attitude. What the patient wants, what the patient needs. Sometimes even these two might be different. What the patient wants, what the patient needs, and what the patient can afford. Even if you think, okay, you are orthodontist or you're not orthodontist, patient wants aligners only, but you cannot do it. Get someone who does aligners well and get it done. So until and unless your goal will be patient-centric, you are not able to deliver what's the best patient wants. Give what patient wants, what needs, what efforts, and then you are happy and patient is happy.
Okay. What is your view on direct-to-consumer aligners or the DIY aligners?
Yeah, India being a very democratic country, not many things do happen in medical field also. I think you are quite aware of the ads in Naptol, where you wear particular kind of chappal and you will increase your height in 2 or 3 feet. And in a day where you see so much fitness industry, people are really working out like hell to shed their weight. Still, you have ads showing. You take these pills, you drink this juice without exercise, without any diet, you are going to lose your weight. When such a thing exists, so definitely direct-to-consumer aligners also do exist. Whether they are regulated by the governments or the associations is not in our hands. But I feel ever since these have come into the market, the leather market increased. So when you have something bad in the market, the value of good is appreciated much more well.
Okay. In my opinion, there are like 70% of the companies are shut down who were providing DIY. Do you think the return of market is possible for them?
And you see, anything that is like not having results on a long-term basis will not survive.
Okay.
So maybe of the concern, we asked Invisalign in the top executive field, the CEO of Invisalign and all in international forums, that Indian market is like very big. So why don't you reduce the prices, especially in the context where there's so many smaller companies and lot many dentists are doing direct themselves and even direct to home also are coming. Then their simple answer is, the more we know, the more we have bad products, the more we are selling in India.
Gee. Sir, you have to apply a certain force to the teeth to get aligned. That is called optimum orthodontic force. If you apply more than that to straighten your teeth, the root resorption will occur.
Exactly. Yeah.
But few companies have come up with this term called accelerated orthodontics. How much do you support that idea?
No, I don't support it. Nature has given us this wonderful healing capacity. We should use this capacity in an optimal way to move the teeth, actually speaking. So if you put anything excess force for faster results, it's not going to work out. And it's going to be either relapsed or it's going to be even taking longer time than what is anticipated. So do not resort to this kind of accelerated on a college level, because I have been a PG teacher, I've been a UG teacher, I've been a PG guide and UG guide. I have seen all these things that have been done in the colleges for the research purpose and for the thesis purposes. But when it comes to the practical approach during clinical sessions, you cannot keep experimenting on your patients, because the patients put a lot of trust on you. And so you cannot just play with their trust, and you should only give them what is tried and tested.
Right.
And do not give them false promises that, okay, it can be done in 6 months or it can be done in 3 months. What can be done in other ways, 1 year or 2 years. You cannot have shortcuts when you're moving tooth.
Okay. If you are straightening the teeth very, very fast, what are the damages it can cause?